Hey, everybody. Welcome to Ask Our Vet, brought to you by Rockwell Pets Pro. I'm Mike the Voice Monkey, here as always with Dr. Max. Dr. Max, how are things going with you this week?
Things are good. Can't complain. Busy week in the office, and yeah, it's been Passover too, so I was away until was it Saturday through Monday. Yeah, Monday night, the holiday, first few days of the holiday ended, and just back in the hospital since then. And it's been a bunch of some critically ill patients, some patients, cute little puppies. My last patient today was a little Shiba Inu, 8-week-old thing. It was awesome. But yeah, we've had a number of lameness and ringworm and diarrhea patients, and those that and this one dog, oh my gosh, has a really big mammary tumor. First time ever coming to the vet. She's 5 years old and never been spayed. And so that was a hard conversation with the owner, but I think she's going to need surgery. So we'll take care of that. But we'll do the med check, and I think that'll be important to do first.
Yeah, people always wait until it's the first time I've ever seen a vet, and it's always something horrible. And
right.
Yeah,
so that was a little hard, but really big. It was like a grapefruit, really big thing, really firm. But we're gonna hopefully take care of her. So
that's why it's important to get those dogs spayed and neutered when they're. If you're not going to breed them, then spay and neuter them. You're going to avoid a lot of problems down the road.
Thank you, Bob Barker.
Hold on, where's my microphone? Have your pets spayed and neutered. Oh man, sorry, I am tired tonight, man. I got my first COVID shot a couple days ago, the Moderna. Oh. And I don't know if it's because I had COVID before and I've already got antibodies, but it just really kicked my butt. And I mean, I was fine after I got the shot. It was all good. Woke up yesterday morning, felt like I was hungover. And it was just, I was tired. All I wanted to do was go back to bed. I started running a fever. It got up to 102.4 was the highest it got yesterday. And just laid on the couch, moaning and groaning, all day, just sweating. It was horrible. I'm really like, oh boy, I can't wait for the second one. And I think last night my wife was like, yeah, I'm not going to get the vaccine after seeing you laying there like a beach whale the whole day. But yeah, I'm fever's gone today, but I'm still a little off. But yeah, I just want to go back to bed. It's been one of those days where, but I guess it's good to get vaccinated, but I don't want to get political. But yeah, it's just.
For sure. Well, I'm proud of you for getting it, and I also got the Moderna, and thankfully, at least for the first dose, I'm still jury's out on the second one, which I'll get next week. But I didn't have as bad systemic symptoms. But I'm glad that you're hopefully on the mend here in terms of the side effects. But
I mean, it felt like when I had COVID, it's what it felt like. Obviously, because your body's reacting, and my antibodies are going, hey, what's this? Come on, bring it on. I'm going to go kick its ass, kick its butt. And just a fever and the headache and it was brutal.
For me, it was all localized, like, just arm soreness. And then my axillary lymph node got really big and started hurting for like 3 or 4 days. But it gets better. You make it through.
Makes it a little hard to recommend. You're like, oh, geez. Oh, really? You should get it.
It hurts. Right. You should really get it, man.
I want to let everybody know who's watching that if you guys want to ask any questions, I think you can either put them on Facebook or go to Rockwell Pets Pro page for the Ask Our Vet, and you can register there and ask us questions. It doesn't have to be on topic tonight. Our topic tonight is seizures. But it can be anything vet related. Or if you want to ask us about the vaccine, I don't care. It's fine. But we've had one question so far this season, so let's try to double that tonight. Get up to 2 questions. So any other cases this week? Anything interesting you saw you'd like to tell everybody about?
Yeah, one of the things that I can do is just kind of scroll through my photos, and that's a good way of trying to find out what where the excitement was this week. Yeah, I think that mammary tumor was definitely the thing that struck me the most. And yeah, I mean, that was the big one. And then there was another dog who came in today with, I think she must have just probably eaten something off the street. The owner says that she likes to get into the goose feces, like out by the river. But so that's likely something that causing her symptoms. But I looked through her history, and actually she was treated for tetanus in the past, which was kind of, I didn't see her for that, but looks like last September she had that. And it was kind of strange because the owner said that she didn't know what she could have gotten into that led to this, tetanus, like paralysis. But she said that she encountered a dead pufferfish by one of the beaches on Long Island, I think. And they have like this tetrodotoxin, and that could have potentially caused it. I've never experienced that. I don't know how to treat pufferfish, toxicity, but that was interesting to kind of read through the historical notes there. But she resolved, got better from that, and now she's here for some.
Well, as we all know, pufferfish and goose poop are rare delicacies around the world. Dogs know more than we do, so
true, yeah.
Got to go with what the dogs know.
Yeah, it's particularly, in certain like hamlets in New York and the locales in Long Island is that most appreciated. They have a specific recipe.
Big pufferfish eaters there. Yes. Right. Well, I don't want to alarm you, Dr. Max, but we actually have a question.
Oh, fantastic!
It has come over from Rachel McLean. Let me put it on the screen here.
This is Rachel McLean. I think she asked the first question, no?
I think so. How to stop the dominant behavior of my fixed male mixed breed to stop mounting dogs and then growling like he's about to fight the mounted dog. Oh, that sounds like some dominating behavior there. What do you know about that?
So how to stop the dominant behavior of my fixed male mixed breed dog to stop mounting dogs and then growling like he's about to fight the mounted dog. Yeah, I mean, so I guess this is taking place. I guess I'd want to know more context, Rachel, if you can provide it. This is at the dog park, outside. It's one of those things where, dogs in the pack, if they're meeting at the park, they're going to try to assert their authority, and some will be more dominant, others will be submissive, and it sounds like your dog is clearly trying to assert this dominance. So how to go about stopping it? I mean, ideally trying to remove them from each other, especially if it could potentially get aggressive, as sometimes is the case. He mounted dogs in the park and a family friend's home. Yeah, and it happens even for dogs who have been neutered. It's still a behavior that can be seen. I treated back in Massachusetts a cushianoid, a dog with hyperadrenocorticism, who was neutered at like 6 months old. Dog, I saw him probably when he was like 10, 11, 12 years old. And he mounted everything that moved. Every time he came in for an additional like blood test to monitor his values, the response to his therapy, he would go over all the technicians, myself. Thankfully, we keep the dog separated in the hospital, but it's one of those things that's quite hard to do. So avoidance is probably my first and foremost recommendation there, especially if he might have the penchant for potentially becoming aggressive, as we want to avoid any bites or anything like that. But I don't, I wish that there was a way that I could tell you an easy fix, Rachel, for this. I'm sure that many behaviorists have recommendations as to how to try to kind of make this behavior extinct through whatever behavioral modification program it may be, whether it's clicker training or distraction, something that he will either avoid this behavior altogether or just physical separation. If it seems like he's getting really excited, wagging his tail, kind of starting to jump a little bit, and as soon as you're seeing the preamble to the little dance that he may be doing or whatever it is that could be coming, and kind of be a warning like he's about to do this, trying to kind of nip it in the bud and redirect that excitement to something else, maybe food, maybe a toy that you have, something that can kind of get him away from it. But I think it's sometimes rather difficult to do. But I think identifying those early warning signs, before he actually starts humping, and trying to, catch it before it kind of gets out of hand, which actually leads into seizure topics nicely, because there's a lot of things that you can kind of identify before a dog is actively seizing, which we'll get to.
Oh, excellent.
But,
way to tie it in there, Dr. Max. That's good.
Yeah. I hope that answers the question. Like, I don't know if there's a cure-all method here, unfortunately. But that's what I have for you.
Sure. And if anybody else has any questions, just like Rachel did, just feel free to throw them in there, and we'll stop what we're doing and we'll answer your questions. So we love answering questions. It's a lot of fun. So, all right. So let's talk about seizures tonight. Seizures. How common are seizures in dogs?
It's definitely not the most common symptom that I will see in dogs. I think, as we mentioned in the past, skin issues, gastrointestinal issues are bar none like the top things that patients will come to me for, as far as sick visits. But I don't have the statistics as to what percentage of the patients that I see have a history of seizures. But maybe I will venture a guess between 10 to 15%. And it varies by age, breed, there's all sorts of different, risk factors, if you will.
Are there more than one type of seizure?
Yeah, there are. And just to kind of bring it back for those who are listening, and Rachel, it means so much that you asked the question, and whether my response.
She actually just did this over. She just said, given CBD awesome. In his food. Okay.
Yeah, that's awesome.
Right on.
Cool. For sure. So there are a lot of, homeopathic, natural remedies, CBD oil, medications that we can give our dogs to help with behavior-related issues, often things that may be dealing with anxiety or stress. A lot of my clients have their dogs on fluoxetine or Prozac or trazodone. And those come with their own fair share of side effects. But if the CBD oil is helping, and I know that there's a lot of companies out there that I think we're riding a wave right now in terms of the marketplace, and CBD is huge, and people and that's kind of spilled over into the pet world. I've had some patients who've actually come in for toxicity, and they come in with neurological signs, and maybe even seizures. So there's a lot of or lack thereof of regulation or FDA regulation when it comes to a lot of these products. So you don't know always what your dog is getting when you do get one of these CBD oil products. But there are quite a bit of reputable companies out there. One of which is that I'm familiar with, Elevet, ELLE Vet, that puts a lot of R&D into their products. And but I'm really glad that your dog is on the CBD, and that happens to reduce the frequency of those situations in the dog park and with your friend's dog.
And some dogs, just like some people, maybe just act that way. So sometimes you can't do anything about it. So, I know some people growing up that just, no matter what kind of behavioral modification you would do to them, they would still, act that way. So
it's true.
You never know. You never know. So
you never know, exactly. You never know what you're gonna get. Yeah, it's like a surprise pack of like M&Ms or something.
That's right. That's right.
But yeah, when it comes to seizures, what is a seizure? I guess to start off, it's going to be an excessive electrochemical activity in the brain, in the cerebral cortex, and it's like disorganized, just all over the place, and that can lead to a couple different types that you'd asked. There's focal seizures, which is kind of an involuntary movement of a particular body part. I think a common classical thing would be like a dog who's kind of like lip smacking. That's kind of like chewing bubble gum.
I like it. That's good.
That's kind of one of the ones that sometimes owners may report. Psychomotor, which is kind of these talk about behavioral changes, kind of like a sudden acute change in behavior. Could a dog who's previously been completely the best dog, lap dog, lovely character, and then all of a sudden just turns on you as if you're not even in the family or something and snaps at you, or fly biting, kind of like biting at nothing that's in the air, and just perceived whatever they may be thinking about or visualizing. And so that's another one. And then I think the most common type that we see in veterinary medicine is the grand mal seizure, and that is kind of like the tonic-clonic variety, where you get periodic or switchings from being completely stiff and muscles contracted, and maybe paddling, completely unconscious and unaware of what's going on, potentially urinating, defecating on the ground. And those are the things that you'll most commonly see with the grand mal seizures.
Which ones do you see more often? Like, which one is the focal versus the grand mal? Is it you notice the grand mal more because it's more dramatic?
I think it's more dramatic. Yeah, I mean, it's possible that some of the focal seizures may even go unnoticed by owners, but I think that the most common types that we hear about or reported or get videos of in veterinary medicine are the grand mal ones. And there may be components of it. So, there may be, and they all differ. Some of them can last for a couple seconds, others can be like a minute or so. And usually a dog, it also may be in his or her sleep, collapsed down on the ground, really stiff, paddling, plus or minus urinating and defecating on oneself. So those are kind of the common signs that you would see, and maybe not all of them during the same episode. But usually, when we get a history, especially for a dog who it's the first time that the owner has reported this, you have to ask some qualifying questions, because the owner may describe in great detail or show a video of something crazy that they're seeing, and it is very scary. You'll Google some dog having seizure. It's a sight to be seen, and can be really scary for dogs, I'm sure, but their owners of course as well. And one of the things you want to parse apart is this a true seizure, or is this syncope? So it's kind of, I remember in vet school, one of the things that they kind of hammered into us is it syncope or seizure? So syncope meaning like a fainting spell, usually from like cardiovascular collapse. And obviously, if that's the case, you're going to go about treating it much differently than if it's something, in the brain. And one of the big ways to differentiate seizure versus syncope would be what's going on before the dog is, having this active seizure. And so as well as afterward, because some dogs who may collapse from like a fainting spell, they potentially could get right back up, no disorientation, they're not dazed, they're just doing their thing, but for whatever reason, for, a particular few moments, they're collapsed. With seizures, that's not the case. There's something called like a pre-ictal phase. So ictus referring to the actual seizure event, and pre-ictal, so before that, and this could be 30 minutes, it could be a few seconds. An owner may notice the dog pacing around, panting in the house, seemingly just unaware of something that's going on, and that can be an indication, to kind of help with history taking for us clinicians. We ask about what's going on during the event, how long it lasts, what they're noticing, and then we kind of go back to what happened before as well as afterward. And usually the post-ictal, like recovery phase, the dog still may be disoriented. It may take a few minutes sometimes for them to kind of come to the real world. They may lie on their side for a while, sometimes sleep longer, and start wandering around the house aimlessly. So that's kind of very important to ask the owners about.
Are all seizures caused by epilepsy, or is there, if your dog has a seizure, can you assume epilepsy, or could it be something completely different?
Yeah, so that's a great question for sure. And so when we refer to seizures and their causes, there are multiple ways to kind of go about differentiating them and using diagnostic method to rule out some causes. And what I can tell you when it comes to so you mentioned epilepsy, so idiopathic epilepsy is for sure one of the most common diagnoses that we have for dogs who have seizures. And what we refer to idiopathic, we mean we don't have we don't really know why. There does not. We've ruled out some of the other possible causes, so infectious causes. We've done baseline blood work or urinalysis and CSF tap, like a cerebrospinal fluid sampling, to rule out, an infectious cause. History of toxicity. Some owners who, unfortunately, it can get rather expensive when it comes to testing. So like doing an MRI would really be the gold standard to rule out structural type causes for seizures. So something with intracranial in the brain that is potentially a focus for why a dog may be having seizures. So that, especially for older dogs, you may think of a tumor. And I'd say the most common type would be a meningioma that can be coming from the skull and kind of putting pressure in the brain and leading to the symptoms. But yeah, so epilepsy is definitely a differential diagnosis, and it's kind of like a diagnosis of exclusion. So kind of going through the laundry list of diagnostics. Sometimes owners will, one by one be comfortable with going through everything, but it sometimes for many it's cost prohibitive, and many just opt for treatment without necessarily knowing the cause. I would say for the vast majority of my patients, that is the case. for financial reasons, or whatever, they don't necessarily care what the cause is, but prefer to seek treatment because they don't want their dog to suffer. But just to go through it, I've compiled kind of a list here of, certain things that cross my mind when it comes to seizures. So there's, you break it down by intracranial causes, so stuff within the brain. So you could be thinking about like congenital disease. You think about like little chihuahuas, small breed dogs that have the big heads and or maybe open fontanelle. So they can have like this condition, water on the brain, hydrocephalus. So that could be a reason for it. So especially if you see a young dog, puppy, less than 6 months old or something, who's having seizures, that should definitely be on your differential list, as well as infectious causes. If the dog's not fully vaccinated, say for canine distemper virus, that's a big one. Other causes could be like meningitis, rabies, although I've thankfully never seen a dog who has rabies. I'm grateful that I've never seen a patient with rabies. But that's definitely, infectious causes. And then the other things that you think about would be head trauma, blunt force trauma from, potentially a hit by car case, or, abuse case, if someone's not treating a dog well, and, we don't have to get really into that nitty gritty. But trauma is most definitely something, and, scar tissue in the brain can lead to seizures. Intracranial neoplasia, or a tumor like meningioma, is another reason. And then we kind of, the other category would be extracranial, so outside of the brain, things that can lead to seizures. And, we're talking about toxicity, chocolate toxicity. Dogs, we think of them vomiting, having diarrhea, puking their brains out, but they can, if they eat enough of it, potentially can cause neurotoxicity. Lead poisoning, antifreeze, marijuana. We just spoke about the CBD oil. So THC is different, but same plant. Snail bait, pesticides, getting into certain medications. Those are some causes from the toxicity route. And then metabolic disorders would be kind of the final thing that I think about. So liver disease, certain like insulin producing tumors in the pancreas, like an insulinoma, can lead to a severe hypoglycemia, so low blood sugar, and that can very much lead to some seizures.
Okay. I've got a question here, again, from Rachel's loving this show tonight.
I love it.
Do dogs get auras
before or after a seizure? With my epilepsy, I'd be really tired. Yeah, I mean, so as we mentioned, kind of the what differentiates seizure from syncope is this phase before and after the seizure, and so most definitely, excess lethargy could be one of the things that can be noted, especially in a post-ictal phase, because with all of that disorganized, just crazy electrochemical activity going on in the brain, that can be, every time a dog is going through a seizure, that's, kind of like, think about it as this irreversible brain damage. And obviously the longer the seizure, the worse it is for the patient. And, we haven't touched on it quite yet, but, as far as indications for when to start treatment and whatnot, something called status epilepticus, which I don't know if you or your dog is the one with epilepsy, but
She is.
You have epilepsy.
She is, yeah. Mm-hmm.
Gotcha. And so I'm grateful that I haven't gone. I don't have. I can't empathize with my patients when it comes to this particular set of symptoms that they may have. But what I do know is that any organism, human or dog alike, who goes through 5 minutes of this intense activity in the brain, that is undeniably stressful and takes a lot of energy. And so being really tired afterward during this post-ictal phase, sleeping or just being kind of out of it is completely expected and understandable. So especially for the longer that any particular patient is going through these symptoms. So that's definitely something that's seen before and or after.
I had a dog growing up, and he was a golden retriever, and we noticed he may have had a brain tumor. We never scanned him, so we weren't real sure. But one day he started having seizures, and it was just boom, he'd have a seizure. And it's horrible to go through as a pet owner. As much as I've been in the business, it's still, when it's your own pet, it's like, and he had seizures for 2 or 3 days in a row. And then we put him on a new medication. I can't remember what it was, but it stopped the seizures, but it also completely changed his personality. Like he just walked around the house like, ooh, what's this? What's this? Ooh, what? I never seen this before. Like he didn't know us. And he ended up snapping at my baby at the time, which he'd never would have done normally.
Yeah.
So we had to make the decision to put him to sleep at that point, because it was just, and kind of half of his face was a little sunk in, kind of that atrophy over where we suspected his tumor was. But he's a golden, so he's gonna get a tumor eventually. But yeah, I mean, having a seizure is tough, and that's kind of what I want to go into now. When your pet has a seizure, what should you do as an owner? We all know it's scary because you have no idea what's going on. A lot of times it could be in the middle of the night, and you're falling out of bed. You're like, what's going on? And your dog's paddling, he's foaming, you have no idea what's going on. What do you recommend people do in that situation?
Yeah, I mean, it's one of those things that I'm grateful. I've never actually experienced it with one of my own pets, and I'm sorry that you had that experience with your previous golden, and the change in behavior and snapping at your child. And it's there's a lot of emotions in the moment when a dog is going through a seizure, say specifically a grand mal seizure, and you don't know how long it's going to last. But what you want to do is try to ensure that you don't try to interfere, really. You don't try to hold the patient down, grab the legs or anything. You kind of want to stay far away, or not far away, but, a safe distance. You can offer words of encouragement, but, the point is you don't want to make sure there's nothing, hard or, dangerous, in all the movement and, fervor that, the dog may be exhibiting. Something could fall down on him or her, or if there's anything sharp, get that out of the way. If there's blankets or pillows that could be kind of blunting, or cushioning, potential fall or whatnot, obviously you want a uniform surface on the ground, and ideally like away from anything that can break or hurt him or her. But once again, do you wait it out? Do you try to intervene? And I'll say there's like not necessarily a right answer. It will depend on the patient and what course of treatment has been done before. I guess for an owner who's experiencing this for the first time, obviously, there won't be any like rectal diazepam, which is sometimes something that some owners have that can be given parectally to try to get the dog out of the seizure and make it stop sooner. Giving something orally while a dog is seizing is a bad idea. Recipe for getting bitten potentially. Is dangerous for the dog and human alike. So if it's going on for the first time, just be there for your dog. Be there when he or she comes to and starts to enter that post-ictal phase, and that's going to be when they're conscientious of their surroundings and maybe salivating and nervous and restless, and it's kind of good to be there for them. And even though they themselves may kind of try to hide away from you or get away, that could be normal. Don't necessarily go chasing for them. Kind of let them do their thing, but obviously, close, maybe restrict the area, close the, environment so they can't get anywhere there, that you can't access them. Especially if it's a first time seizure that goes on for more than 5 minutes, once that's over, you're really going to want to bring the dog to the ER immediately. Because status epilepticus is like an emergency. But if it's something that may last like a couple seconds or a minute or so, just kind of let the situation end. Don't be forceful or like immediately rush to your dog. Kind of gently, maybe use some calm words of encouragement. As they regain consciousness, kind of rub their belly or back or an area that they may like, but kind of see how they respond, because every patient is different. And I've never experienced a seizure, thank God, myself, but I know from seeing patients who've actively seized in the hospital, to hearing accounts or seeing videos that owners have shared with me, every episode is different, and it's sometimes not predictable. And obviously, if it's happened for the first time, there's going to be a lot of emotions. And I think what I would impart to owners is that a dog who, many dogs may have like a seizure for the first time ever, and it's documented. They come to the vet the next day. They schedule like an emergency exam or kind of like a same day appointment or something to be seen. I see that dog and they're perfectly fine, as if nothing's ever happened. And I'll tell the owners, with this seizure, whether it was focal or grand mal, generalized seizure, it happened. It's the first one. Continue to monitor for other ones, but that doesn't necessarily mean we are going to, start therapy or, pursue diagnostics. Especially big time diagnostics like the cerebrospinal fluid or MRI immediately. I think baseline blood work is good, urinalysis, but I wouldn't jump to those, for a first time seizure. I would explain to owners, first off, I would find out what the patient's signalment is, how old they are. I think, we haven't really touched upon tonight about, the age of the patient and kind of how that factors into how we go about talking to owners about the differentials associated with a particular age category. So if it's less than 6 months old, a dog who comes to me for a seizure, I'm thinking something infectious, or maybe even parasitic, toxoplasma, like especially in cats, or Neospora or canine distemper. Those are kind of the big boys when it comes to that age group. 6 months to 6 years is kind of what we are trained to think about. We think about idiopathic epilepsy as being like the primary differential diagnosis, which is something that obviously requires, excluding all other things. But for owners who understand that is most likely what's the cause for their dog seizure, they, hear that information, and, we kind of decide together as what's the best way to work up the patient. And then a dog who's greater than 6 years old, you start thinking about the structural reasons, such as, intracranial cause like a tumor potentially, which kind of really does require imaging, like the MRI. So those are kind of the very rough breakdown of what you really think about when a patient presents for the first time and has ever had a seizure. Because I've had dogs who they've had one seizure their whole life and nothing else has happened.
That's it. Yeah.
And there's really not necessarily an indication to start them on an anti-epileptic drug for like, a one-time thing. So owners who, have experienced, you asked what to do when a dog is actively having a seizure, bring the dog in the next day, have this conversation with your vet and, kind of create a game plan. But rarely would I, or never really would I opt to start a dog on an anti-epileptic drug after a single seizure. I would really like kind of my indications for starting would be if, after a single seizure that was not greater than 5 minutes. That would be my caveat for like what I started a dog for on a drug after one seizure. Yes, if it's lasted for greater than 5 minutes. Otherwise, when do we start dogs on treatments, regardless of really knowing what the cause is yet and maybe not having completed the diagnostic workup? So I would say for dogs who had the status epilepticus, for dogs who have greater than 3 seizures in 24 hours. So we call those like cluster seizures, happening all in a cluster. Those are kind of the big two times during which I would, I would have that conversation with owners, just because, a lot of these drugs, as you'd mentioned, there was a change in your golden, in terms of personality. Mm-hmm. There are side effects with them. They can do, they can work wonders, and a lot of them can achieve really good results and reduction in seizure frequency for a lot of patients. But you don't necessarily start them without like the status epilepticus or the cluster seizures.
So I have a little clarification here from Rachel.
Sure.
What she was asking when you're talking about when your dog is actually having a seizure. She had on there.
Do you mean like hold the dog on its side slightly so it can't hurt itself, but stay behind the dog's back and just wait it out?
I think she means, just kind of pet your dog, let him have his seizure, or do you need to actually back away and stay away from the flailing, or make sure he doesn't knock a lamp over on himself or something?
Yeah, I mean, ideally just remove all of the, I would say, to clarify, I would remove, your presence is less of an important thing than you removing the things in the immediate environment that could pose a problem. Because it's
more for you to be there than it is for your dog.
Right. Yeah, I mean,
you feel helpless. And if a dog has a seizure for a minute, I mean, that feels like forever. If you're just sitting there watching your poor dog have a seizure, and you can't do anything, you can't stop it. You're just along for the ride, and that is a brutally long period of time just to sit there and do nothing. I mean, we had in college we had to give speeches. We had a senior seminar. We had to come up with a topic, and we would have people. You'd be so nervous when you get up there. People would get up there and get lost, and they would spend 30 seconds trying to figure out, like, okay, where am I in my speech? And that 30 seconds where everybody is staring at you feels like forever, especially when you're in the audience. And the same thing with your dog. Your poor dog's having a seizure. You want to help it, but you can't. Yeah. So you just have to wait.
Yeah, for sure. I mean, I remember I had a dog like this Italian Greyhound. I think of Goldens, Labrador Retrievers, um, German Shepherds, uh, Cocker Spaniels, Schnauzers. Yeah, those are kind of breeds that I would see more often. I think who have seizures. But I saw this Italian Greyhound at when I was working in Cambridge, um, who had like I was in an appointment. This was like back in COVID, but when we were seeing clients in the exam rooms, it feels like so long ago. It's like 2 years ago. And I was with a client or in the room, and then someone like opened the door and was like, "There's a dog seizing in the PetSmart lobby." And so I like excused myself, ran out there, kind of assess the situation. And what I did was, just told everyone to like get away respectfully. Like, don't crowd this area, kind of just back up, we got some towels to like put around the area. The dog did urinate on the floor. But that was kind of just a crazy moment. And then he came to, we brought him in, did some blood work and got some diazepam for him. But it was pretty scary. But really the goal is to just like remove anything that could potentially lead to additional like physical harm, because there's already harm going on in the brain. You don't want anything that's going to, harm other parts of the body. And, what's possible is that, our dogs may have seizures when we're not home. And, it just so happens at times that we are privy to what's actually happening. So, it's hard for us to experience them going through that for sure. But I think divorcing our emotions from the situation, as hard as it may be, and, getting a watch, I think, to kind of time it, or a video, which could be helpful for your vet to kind of see what is happening. Trying to get those things on deck, and keeping a safe distance without really like intervening and, holding or petting your dog during the experience. You can be close, but not too close is what I would say. And really just trying to being close so as to remove anything that could be potentially dangerous for your dog, Rachel, is what I would say. But yeah, that's, it is, it's one of those things that it's really hard to see any animal go through that. And, yeah.
Absolutely. It's brutal. Wanted to let everybody know, it's kind of a weird change of subject, but if you want $10 off natural dog ear cleaner, go to rockwellpetspro.com and use the promo code CLEAN. And if anybody has any other questions, feel free to throw them in. We got a few more minutes here. Let's talk about treatment options for seizures. What can we do to help these guys? Can you actually cure seizures in a dog?
Well, I mean, I'll say yes, you can. I mean, you may have a dog who's had, cluster seizures and start them on an anti-epileptic drug. And depending on the one you choose, just, monitoring, however many months, at certain intervals to make sure that, the level of the drug is a therapeutic range. And, so for example, can you, it's hard for me to truly answer that. It is possible for a dog who has been started on anti-epileptic drug to never have a seizure again, or at least an owner may never see them having a seizure again. That is quite possible, and I would say sometimes very frequently seen. Some of these drugs have greater than 50 or 70% efficacy at reducing, frequency of of seizures. They may not cure it altogether, but I definitely know of patients who have never had them again after having, a severe bout earlier in life. But I would never tell an owner that this is going to cure it. There's no guarantee. There's never 100% guarantee. But I would say the 4 drugs that we have at our disposal that are most commonly used when it comes to epilepsy would be phenobarbital, potassium bromide, zonisamide, and levetiracetam, or Keppra, the brand name. And all of them have, most of them are dosed twice daily. Zonisamide is every 8 hours. Keppra they have like an extended release capsule, so you can do it every 12 hours.
I think that was the one we started on. I think Keppra was the one. Yeah, because it had just come out. This was about 10 years ago. So it had just started to come out as expensive, and I had to go to Costco pharmacies, the only place I could find to get it.
Yeah.
And it worked. I mean, he stopped seizing, but like I said, it was like a newborn puppy. Like everything was new. Hey. So yeah. It's tough though.
Sorry.
I mean, I guess it depends on what causes the seizure, obviously, is whether or not if it's toxicity from a medication or a food, then obviously don't feed that food and voila, seizures are stopped. But I guess more on the lines of tumors or epilepsy or something like that. Do you recommend CTs and MRIs and all those kind of things if it continues?
For sure. I mean, always collect a minimum database, getting blood work, the CBC, chemistry, urinalysis, be able to take a look at some liver enzymes, blood sugar. Those are kind of the big values that I would be looking at in terms of that, as well as do a urinalysis too. Theoretically, certain metabolic or endocrine disorders, you can see changes in the urine-specific gravity, and that can kind of lead you down a different diagnostic tree in terms of tests that can be run. But for young dogs, like a portosystemic shunt, you may see some liver enzyme changes, and doing an ultrasound, would be key. But definitely, like a dog who comes in for the first time, I would never say, "Oh, we're referring you to the neurologist immediately," necessarily. Collect all the baseline stuff, which neurologists, when you refer out, they're going to require a certain, we don't just jump to an MRI, we don't just jump necessarily to surgery. When it comes to this, like obviously, when it comes, if a tumor is diagnosed, for example, after doing the MRI, some of them can be removed surgically, and but you obviously don't do surgery on a patient without diagnosing it. So it's definitely one of those things that ruling out some of the obvious stuff, hypoglycemia, seeing if there's evidence of toxicity, and so liver enzyme or kidney value changes, fluid therapy is needed to kind of detox and just kind of the solution to pollution is dilution, and just kind of get that flushed out. So you need to collect that information before you move on to the next step. But those medications, like as you mentioned, they can have a really significant effect on patients' quality of life and reduce the frequency of the seizures. So, but definitely, for the phenobarbitals, the potassium bromide, you definitely have to constantly monitor, values in the blood every couple of months, because phenobarbital especially can have some side effects. Sedation, lethargy, gastrointestinal upset. It can lead to toxicity in the liver if it gets to too high levels, so you need to potentially titrate the dosage. Potassium bromide can cause pancreatitis. So there's all things that you need to let the owners know about, and have them be cognizant that no drug is benign, and sometimes it can produce these weird side effects.
Sure. I've made up my fair share of potassium bromide in the ways we used to make it. We had a neurologist on staff, so we had the seizures and everything. So we get the big amber bottles and mix it all up and send it home with the owners. And it's funny. I've been out of the game for a little while, but then I hear you mention the drugs, and I'm like, oh yeah.
Takes you right back. Yeah.
Oh yeah, I remember making that up. Yeah. Feed a barb. Yeah, mix it up. So, well, I guess we're getting ready to wrap it up here. Time's almost up. Any final words you want to tell everybody about seizures?
Seizures are. I think we've touched on a lot of very important things. I guess Rachel, thank you so much for your questions.
Absolutely,
it really means a lot to have active participation with the people watching. So really appreciate that. And then I would just kind of reiterate the stuff that I would say, if your dog is actively seizing, the most important thing is you being there for the patient or for your dog is in some ways the best way to being there is being out of the way, and just trying to prevent them from hurting themselves. It can be scary, but it can be manageable. Especially given the fact that status epilepticus and cluster seizure events are not always the types of seizures that we see, and therefore treatment may not necessarily be indicated. Kind of just keeping your vet apprised of all these that happens, keeping a log of when things happen, being able to document via video or timestamps as to when things are happening is really important for your dog, and can really be helpful in terms of basing the ideal treatment plan for him or her. So really appreciate you watching and asking those questions.
Awesome. And don't panic. If your dog has a seizure, don't panic.
Don't panic.
Run around with your hair on fire. So it's, make sure you have a number for your nearest emergency clinic and know, you can call them and ask them questions and they'll be happy to help you. But yeah, don't bundle your poor seizuring dog up in a blanket and throw him in the car and take him in. It's going to freak your dog out even more when he wakes up halfway down the road. So, but anyway, thanks, Dr. Max. It's been a great show tonight. I believe we are off next week for spring break, but we'll be back the week after next with another exciting topic. And until then, thanks for watching, everybody. Go to rockwellpetspro.com and use the keyword clean to get $10 off natural dog ear cleaner. So there you go. So
there you go.
You guys have a great week. Thanks, Dr. Max.
Thanks, Mike. You take care.